One of my continuous effort and my ambition is to be able to build strong research capacity in terms of human genetics on the continent, and to be able as well to uncover really the breadth of knowledge that we need to get from the diversity in human genetics on the continent to be able to transform it in terms of public health. I'm 𝗟𝗲𝗱𝗲𝗏𝗏 𝗟𝗲𝗰 from Burkina Faso. I'm a researcher in human genetics, and I'm an alumni of the AREF leadership program. During the last couple of years, I've been working in human genetics, trying to understand the genetic susceptibility to disease, specifically non-communicable disease with a focus on cardiometabolic disease. The idea of this research is to try to understand how genetic background in Africa and the genetic diversity can drive the susceptibility to certain disease on the African continent. After completing my PhD, I returned home to start to build a program of research in human genetics in my country. And you have to know that human genetics is a field that is very scarce in Africa and the continent. So there's still a lot of things to work on and to do and to discover and to uncover. So I started building a research program there and contributing to training and capacity building in my program. And I think at some stage, I felt that my impact and the reach of the effort that I'm doing in terms of building research in human genetics should be extended. So, and I had the opportunity to apply for the position to lead the genetic epidemiology at the MRC Unit The Gambia. So I'm now having a joint appointment for which I'm leading both portfolio in both institutions back in Burkina Faso at the Clinical Research Unit of Nanoro and at MRC Unit The Gambia as well. Along the way, trying to set the team and things, I came across the AREF program for the Leadership Toward Leadership program. Through this program, I have been able to learn that leadership is not just words or a willingness to do things, but leadership is actually a science. And implementing the science of leadership is leading to a more efficient leadership. One really valuable part in terms of the AREF Toward Leadership program is both the mentorship and really the quality of the trainers and the people really that they're inviting to kind of like really give us more insight and how to strategize the leadership towards which we should be working. And as well, I think one key component is the peer support and the peer support that we have in the groups. Because somehow it's easy to take advice for people that you'll say, okay, they're more advanced than you, so that they think that some things are easy. But being able to have the support from the peers, the experience sharing, it's making you realize that you're not the only one facing the challenges. And then it gives you an idea as well of how to address those challenges and to move forward within this community. My ambition is that in the couple of years, we're able to bridge the gap that is existing in terms of genomic medicine area. In other continents and in other settings globally, you can see that genomic medicine is kind of transforming the landscape of care and healthcare that is offered to the population. But on the continent, you cannot see this transformation happening. And I think one of really my goal is really be able to contribute to fulfill this gap in terms of knowledge and in terms of transformation for the better health of African population.